Well, each year, more than 2 million women hit menopause across the U.S.
Those changing hormones can also have an effect on your heart health. So for more, we welcome Dr. Leslie Cho at the Cleveland Clinic. Good morning to you.
Thank you. Thank you for having me.
Our pleasure. So let's talk about some of the things that may have changed. Traditional therapy was seen as it might have some long-lasting effects on heart health.
So for many, many years, every woman who went through menopause was offered hormone replacement therapy. And then there was a trial, a couple of trials that show that, you know, hormone replacement therapy may actually increase heart attack and stroke and may even increase death. So of course everybody fell out of the hormone craze.
Right.
Now we've sort of rethought about that process, but hormones still should be only reserved for menopause symptoms. So kind of things like hot flashes, mood irritability, sometimes depression.
Now, talk specifically because estrogen is really kind of in younger women have blocked from creating heart issues, right? And so as that decreases, then we have the problem.
Absolutely.
So kind of talk about that, and then also the age and even symptoms to probably look out for that maybe a lot of women, younger women, don't know much about menopause.
Yeah, so you're absolutely right. Estrogen is actually really good for the heart. It lowers your cholesterol, it lowers your blood pressure, your arteries are more dilated on estrogen, it helps decrease platelet aggregation, so it's actually really, really good. And as you go through menopause, your cholesterol level goes up, your blood pressure goes up, so of course everybody thought, well, replacing estrogen would be good, but unfortunately that hasn't really panned out. What is important is that every society, the American College of Obstetrics and Gynecology, the Menopause Society, the Endocrine Society, the Cardiac Societies all recommend that we do not use hormone replacement therapy for prevention of heart disease, but only for symptoms. And so some of the symptoms of menopause are hot flashes, so you feel hot.
We've heard that, yes.
Yeah, and then of course the other thing is sleeplessness. So people have insomnia, irritability, depression. And it turns out that African American women, black women have much greater symptoms of menopause than Caucasian women. Asian women tend to have less. But you know, one of the really troubling thing is as our society gets more overweight, we have more hypertension, high cholesterol, obesity. Hormone replacement therapy in that population is a little problematic.
So to follow up with that, I mean, what are some things that women can do?
Yeah.
I mean, they're like, oh no, here they come. It's my time. How do I beat this and stay sane, right?
Yeah, no, absolutely. I think one of the best things we can do is something called shared decision making. You and your doctor talk about the pros and cons of hormone replacement therapy. If you're overweight, unfortunately, the hormone replacement therapy may increase your risk of blood clot, so that may not be a good thing. But maybe being on transdermal hormones instead of the oral systemic hormones might be good. Or maybe talking about topical hormone therapy instead of the systemic or the transdermal. This is really about shared decision making and knowing your risk and sort of weighing the pros and cons.
What about just like a healthy lifestyle, diet, exercise, those kind of things?
Absolutely. So it turns out that women who exercise, who live a healthy lifestyle, they don't have as many postmenopausal symptoms. So you're absolutely right. That critical part of eating right and exercising is really important for even decreasing postmenopausal symptoms.
So really just talk to your doctor, kind of figure out what's best for you, because I mean, it may sound like we all deal with the same stuff, but we're all different.
Right.
Yeah.
Different women and dealing with it on our own.
And also, you know, there's this huge wave, like if you go to Goop or if you go to some of the other internet websites, you can order your own hormones, which is pretty dangerous.
Yeah.
Oh my gosh.
Yeah, and so it's really important
Is that
to
right
talk
off
to
of Amazon? Or?
It's right off of internet,
Right.
which is even, And then the other, you can do that for testosterone too. You can actually order your own testosterone.
I've seen the commercials.
Exactly, exactly. And it's not good, right? And so it's really important to talk to your doctor. The other thing is these compound hormone replacement therapy, they're really not that good for you. So we really recommend FDA approved hormone replacement therapy. If you're going to go that route, talking to your doctor is super important.
Yes.
Dr. Cho, thank you so much.
Thank
Good
you.
information
Great
about the heart health and
information.
that menopause too. So.